Welcome to Heart Health with Michelle. Today, we're going to talk about the emotional and physical heart with Dr. Jonathan Fisher, who's a mindful cardiologist. I want everyone to welcome Dr. Fisher to Heart Health with Michelle. If you could please introduce yourself, we'd love to learn a little bit more about you, and then we'll get right into our topic.
Awesome. Thanks, Michelle. And thanks for having me today. This is really exciting. I'm a clinical cardiologist now in medical practice for over 20 years. I'm also a mindfulness meditation teacher. I certified in Oxfordshire in England. And I have been invited to work as a clinical physician executive at Novant Health for the organizational well-being and resiliency of 38,000 team members working to fight against burnout and to improve the well-being of the people who are doing the care.
I love it. That's such an amazing work that you do. I really admire all the work and knowledge that you provide to so many people. Thank you so much.
Thank you.
So let's get right to this. So when we say the emotional and physical heart, what are we referring to? Why should we care about this?
So we're really good in the healing professions of looking at the body as this box, and there's little pieces that are either broken or fixed. And for hundreds of years, most of the time, we've been focused on disease and hunting down sickness. And that's led us, in general, to look at people who come for healing and support, not as human beings, but as these robots or machines that if we can just find the broken part and fix it, well, that makes sense to a point with certain conditions, but it doesn't really heal human beings. And so what we've been learning over the last 50 years, thanks to the combination of psychology, neuroanatomy and physiology, and cardiac physiology, is that we can't just treat the heart in isolation. We have to see the physical heart as a direct result and as a cause of some of our emotional states, whether they're positive or negative. And there's lots of emerging research now, which is now endorsed by the American Heart Association in a number of publications, which are very exciting, which say that we have to add to our traditional risk factors. It's not enough to talk about just smoking and obesity and weight management, which are critically important to keeping us healthy. But we have to talk about things like anxiety, which affects heart attack risk, and depression, which not only increases after heart attack, but heart attacks can increase depression. So there's this cyclical connection. And then perhaps for me, the most important one is this rising epidemic of loneliness, especially in the post-COVID era, because loneliness, we now know, carries a risk of future heart attack of greater than 20%. And there's been research now that's coming out showing that we have to address social isolation in our patients and our clients as well.
Oh, 100%. And it's from every perspective of cardiac care. We've seen a lot of research studies that even loneliness can cause a poor cardiac prognosis, whether it's a heart attack, heart failure, AFib. So how do we address this? So first off, in order to address it, we kind of have to know it's there. So before we even get to all of those how-tos, I want to get a little bit more of a scientific understanding of that connection. Can you go in a little bit more detail of what is that connection that's causing more strain on our cardiovascular system from this emotional and physical well-being?
Absolutely, Michelle. I think about it as there are these three pathways that connect our minds, what's happening up here in our brain, and it's a different story. We talk about the mind as being up here, but we now know that the mind is not here. This is the brain, but the mind is in the gut. The mind is in the heart. The mind is in the body. The mind is this interplay of information, this traffic of information that helps us regulate ourselves. So with that said, there are really three pathways connecting I would say, the emotional heart, which is in the mind, and then the physical heart itself. The first one we think about is sort of in the mind itself. There are chemical changes, emotional changes, psychological changes that happen as a result of somebody cuts us off in traffic. We get frustrated. We start to yell. We get a new diagnosis of cancer, or we have a heart attack or an event. We start to develop these memories, these traumatic memories, and we start to replay them in our mind. We ruminate the thoughts. So this all creates a cascade of events in the mind, and there are neurochemicals there. And then we have these connections into the body by way of two nervous system pathways. We've got this automatic or autonomic nervous system, which is balance between the sympathetic, fight or flight, and the parasympathetic, rest and digest, on the one hand. And on the other hand, we have this vagus nerve, which really activates when the body wants to kind of put the brakes on. So there's these dueling factors there. Now, I've simplified it a lot. There's also the hypothalamus pituitary axis, which increases adrenal secretion of cortisol and adrenaline, etc. But we're working our way down from stimuli in the brain, emotions, sensations, thoughts, just a simple thought of, I'm having chest pain. Oh my gosh, something bad's going to happen. That can raise levels of adrenaline, raise levels of cortisol in our blood. So then what happens? So we've got the mind, then we move into the body and the physical heart. So these nerve signals, which we've talked a little bit about, the chemicals, create changes in the physical heart and the blood vessels throughout the body. And basically those changes include a rapid heart rate, a rise in blood pressure, a constriction in the blood vessels throughout the body, in the brain, in the heart, in the kidneys. In addition, there are alterations in blood clotting factors. So not only do we have constriction in our blood vessels, but we also may have an increased tendency towards blood clotting when we're stressed out, when we're having these really challenging, ongoing, repetitive stress states. And it's a combination of these that now we've got the mind, changes in the mind. Now we see some changes happening in the heart and the blood vessels, setting us up for potential heart issues. Now here's really the key to it all. It's our behavior. So the third piece in this pathway has to do with, well, how do we change our behavior when we're experiencing negative emotional states? Like anxiety, depression, sadness, fear, loneliness, frustration. Well, we all know, yesterday there was ice cream and I really wanted to have it because I was feeling a little stressed out. I was on call last night, multiple calls, and that shift in my mind from that sort of calm, relaxed state towards the fight or flight, high adrenaline state shut down my thinking centers and my ability to regulate my behavior, and so I reached for the ice cream. It was actually lemon gelato. It wasn't ice cream, but it's a different story. And so you can think of all the behaviors now that are more likely when we're feeling stressed out, like smoking, like being sedentary, like I don't want to go to the gym. And it goes on. And these are all risk factors for heart disease. So changes in the mind, changes in the body, changes in our behavior. Now we start to see and understand these epidemiologic studies that show when we struggle with the emotional heart, we also struggle with the physical heart.
And I love it. And I think you really touched upon two different aspects of it, right? So one is the fact that when we are the stress, our blood vessels are getting aggravated. We are causing issues. And when we have that tightening of our arteries over and over again, and those blood clotting factors, we're causing more of a risk for our cardiovascular system. Our heart has to work harder. But then on top of it, those stressful activities are connected a lot of times to these behaviors that it increases our risk for cardiovascular disease as well. And so it's this two-piece part that we need to be mindful of. But so, okay, I always say a lot of times people don't know they're stressed. They don't know that this is happening every day. I've had people who own their own business who say, I love what I do, and this is just part of the job. How do we address this? How do we get individuals to even identify that it's there? Because if you don't know it's there, we can't come in and put any behavior change because we aren't mindful that it's even happening.
It's a really sneaky challenge, Michelle. You hit on it perfectly. I can't tell you how many people come to me and their blood pressure is through the roof in the office. And I know it's normal at home. And I say, are you feeling a little bit stressed? And they say, no, I'm fine. I'm feeling fine. And so, we humans have this amazing ability to delude ourselves and, in a sense, to deny what's really going on. And generally in our society, we have this disconnect between what's happening up here and what's happening in our body. And that happens from a young age. We're taught to do well in school and study hard, but how often are we taught to just pause? Notice what's happening in this body that's carrying you around your whole life.
Yeah.
And the question that you're asking really is one of bodily awareness. Sensations of the heart don't occur in the mind, they occur in the physical chest. Sensations of tension, which we are struggling as a whole community now with so much stress going on. Well, stress lives in the body. We know that. It lives in the body in physical tension and constriction, which is there beneath our consciousness. 95% of our stress is beneath our level of awareness. So what you're asking is, how do we shine a light on those darker areas to get it into our consciousness so we can say, oh my gosh, a little bit of stress is great. It'll help me get my project done, succeed in business, be a great doctor or dietitian, whatever we are. But when that stress lever doesn't get turned off, that's where disease starts to happen. And so the way to shine awareness is just to ask people basic questions, like just checking various aspects of their life. Oh, business is going great. That's awesome. Tell me about your relationships. Oh, okay. Half and half. Tell me about your sleep. How's your sleep going? You know, I'm not sleeping so well. I'm not quite sure why. Okay, let's talk about habits. Alcohol? Yeah, I'm drinking a little bit more than lately. I'm not quite sure why, but I feel fine. So this is where it gets a little sensitive. You know, we humans don't like to have this cognitive dissonance. We don't like to know one thing in our subconscious but tell ourselves another story. And so it takes people like you who have this ability to communicate so well to just gently, as a coach, as a loving, caring, supportive person, just be with the person and say, you know, maybe there's something more beneath the surface here. Are you willing to explore it? Just start with a question. Are you willing to explore what might it be like, even if you're not feeling stressed, to feel even more calm and peace and ease in your life? Are you interested in that? Just open the door. And if they say no, it's not for them. It's not the time. But if they say yes, that's when you can get into really amazing conversations that are not only wonderful for your patients, but also they're really wonderful for you, because now we're connecting on that human healing heart level.
Yeah, I love it. I also think that it's important to kind of mindfully frame your day. A lot of times people won't admit they're stressed, or they actually don't really realize they are stressed. It's their regular day to day that they're just used to, right? And so I'll say, you know what, if you can just devote 5 minutes before you wake up, don't touch your phone, don't look at anything, look outside, just take 5 minutes for yourself to ground your day, and 5 minutes at the end of the day. Ideally, we want this to be longer, right? But if somebody's struggling, even if it's a minute, it's better than nothing. And then once you anchor in that mindful moment before and in the beginning of your day and at the end, you start to realize that it's really therapeutic, and you add more time to it. And then you start doing more and more. It's kind of the same with just meditation and breath work. Many of my clients are like, oh, no, I can't do that. And it's like, yeah, it's intimidating. Or maybe you had one bad experience, or you went and you tried something and it was too long. The first meditation you tried was 30 minutes. That's too long for someone who isn't used to that type of work, right? So start small. And I say, find your own meditation in the beginning. Like if you like rock music and that's what gets you to, check out for and pause for a minute, use that. Because a lot of times people are looking for a stand, saying, okay, someone told me to do meditation. I followed this one person they told me to follow, and it needs to resonate with you. And I think that's a big piece of the puzzle, where people are just like, I did it once, it didn't work. And you need to find the right rhythm for you. But if you go upon your day and you're never pausing, you're never mindful of these things, and you're just trying to, go on this hamster wheel of life and hustle and bustle, it's going to have a very big impact on your cardiovascular health. And so we definitely need to add that in. Can you give any tips on, well, okay, so now I identified that I'm stressed. What can I do in that moment? Or what should I be doing to help reduce these emotional feelings that I have?
It's a great question, and there's a really simple few steps that you can do no matter what's causing the stress. And the general idea here is that we're not conscious of it, and we tend to identify with it. So if something bad happens, we're like, it's not that I'm having a bad day, it's like my whole life is bad. It's not that I'm feeling frustrated, I'm just a frustrated person. And so it begins with this, separation, just loosening of our grip on whatever's happening, and learning to just watch life go by a little bit more objectively. What Freud called, the observing ego, sort of the back of the mind, just watching instead of getting so wrapped up. It's like getting over ourselves. And one great way to do that is just to use language. So put language to what's happening. So instead of, getting mad and doing the normal, which is to act out and yell at our kids or our family or the next person, just thinking, what am I feeling? Oh, what's the word? Anger. Oh, I'm feeling anger. And what studies have shown is simply by putting a word onto an emotion, there's a shift from the back of the brain, the amygdala section, towards the front of the brain, which activates words, and there's a cooling down immediately. Now that's not enough. That's the beginning. In addition, we have to work with our body, and the best connection between the mind and the body is the breath, which you referred to, breath work. So in the moment of feeling stressed out, we notice what's happening. Let's say it's frustration or overwhelm. That's a big one, overwhelm. So we just say overwhelm, overwhelm, feeling overwhelmed. And then we just take a nice deep breath, but we want to take a specific breath in order to connect the mind with the heart and lower the blood pressure. And that's called the diaphragmatic breath. So there's lots of breathing techniques. Many of them are 3,000 years old from the yogic traditions called pranayama. I think we overcomplicate it. I think as long as we're taking a nice deep breath, and I can kind of show you here. So we want to put our hand on our belly. So the traditional breathing, that we do when we're stressed out is what? It's costal breathing. It's chest breathing. And what we know is that tends to rev us up. So we want to shift consciously into belly breathing. And the way we do that is you can put your hand on your belly, and as we breathe in through the nose, like you're smelling roses, you want to notice the hand go out. So moving the diaphragm down. And then we want to blow air out like we're blowing out birthday candles. Bringing our belly button all the way back to our spine as deeply as possible, exhaling completely. So what we've just done there is a single diaphragmatic breath. And if we are stressed and we want to calm ourselves, we want to emphasize the exhale. That really activates the vagus nerve. And that lowers our blood pressure, lowers our heart rate, and we start to break this cycle of stress that happens. And then after that, there's a third piece that I think is really important. Anytime we're stressed out, now we've begun to calm the mind, we've begun to calm the body and the heart. What do we need when we're stressed? We need support, we need love. And so often we go without it. So in this last moment, if we can just, put our hands on our heart or give ourselves a gentle rub or a hug even, or if someone's looking, you can just do it to yourself. Give yourself some kindness. We're all struggling here. And it's hard at this moment. And just tell yourself, I'm here for you. I'm not going to run away. I'm not going to hide. And so that's what's called self-compassion, and you're familiar with that practice. And if your audience isn't, it's just, it's such a powerful technique to really calm the nervous system, like when we're babies. Our mother kind of rocks us and cradles us. Well, some of us haven't even gotten over these issues from our childhood. And we see patients who come to us and they think that all the problems are about some physical issue, but really it's unresolved adverse childhood events, attachment issues, prior trauma, etc., which is where we just want to take a basic approach, label what's happening, take some nice deep breaths, self-compassion. That's a good start.
I love it. That's so powerful. That's great. Thank you for that. Thank you so much. This was lovely. I really hope everyone got a lot of great information and is able to apply this. It's important that we really reiterate that support and that extra support. And if you need that, you should be seeking that from your healthcare provider, from your psychologist, from somebody who can help you further. You don't need to do this alone. And we really want you to realize this emotional and physical connection with your heart and take ownership in your health today. Any last words that you'd like to share with us, Dr. Fisher?
The most important word is, in these challenging times, whatever you're going through, start with kindness towards yourself. It's a really rough world out there, and if we can learn to love ourselves, we can learn to love the world. So thank you.
I love it. Thank you so much. This was lovely. I appreciate your time and all of your words of wisdom. Thank you.